Here is how to answer a difficult MMI question. Question. In contact sports, there has been an increase in head-related injuries and trauma. Do you think physicians should be more involved in the creation of the rules and regulations of these contact sports? Why or why not?
I think that physicians can contribute to it in terms of if a physician knows about the rules of the sports or is being asked for their opinion, they can bring in their own medical expertise in terms of watching a scenario or a play out and seeing all the potential dangers that could happen. They can definitely have an input and, for example, be able to say, like, this play is too dangerous. It has a very, very high risk of injury. However, I don't think that they should have power to completely ban plays. I think that they can provide the knowledge of the potential consequences, and then it can still be up to the deciding parties to determine just what would be allowed and what would not be allowed in terms of their own rules and their own plays and such. But I think it would be good to provide that input from a knowledgeable source. And specifically as well, they can provide more than just the extent of the injury, but also things like recovery time, things like if a player would be able to play again after this, things like also how long of a hospital stay this would be, because we also want to be preventing unnecessary injuries that are going to cause stress on the healthcare system as well, because you have to consider this might not only be affecting you, but also affecting all the other patients that could benefit from the hospital's resources, their staff, their time, their finances, whereas you would be taking up a lot of that from a simple head injury that could have been prevented.
So how did you feel about your answer for this one?
I not too confident. It definitely didn't have the structure just because I don't know, it came out of left field. I was like, what?
Mhm.
I just tried to answer the question itself.
Yeah, definitely it can be a little bit out of left field. And I know Australia has Australian rules football, which is essentially like rugby, if I remember correctly.
Hmm.
So I'm sure that this is commonly talked about there as a potential, but it is one of those policy questions that could come up.
Hmm.
And so I just wanted more policy structure into it. I definitely
Hmm.
got that this one was one that you were a little bit caught off guard with, but
Yeah.
you brought in good pros and good cons as well, kind of towards the end when I asked you about it. But they bring their expertise. They're able to say if plays are too dangerous. I think that that is an appropriate pro to having them involved.
Hmm.
And then a con is that they might not have the sport's best interest in mind. They might
Hmm.
make changes that make the sport less fun or break that nature of the sport.
Right.
And then ultimately, you said that they should kind of just stay as more of a consulting role rather than being actively involved, is that stance that I got. So I had to kind of ask for the cons, but I definitely did get that policy structure towards the end.
Hmm.
And so, yeah, I think overall, I mean, I kind of gave you the awareness in this case in the question, so I don't think that you needed to have repeated that. Overall, I think you had everything in the structure except for maybe that modification, although I guess having them be a consultant is that kind of modification in there.
More videos will be coming your way to help you tackle every MMI question you will face during your med school interview. We can't wait to help you get accepted to your dream school.